Hello everyone, my name is Kamla Jaz Bajwa and I am from BS Chemistry 2017 and my roll number is 7007. Today I am here to talk you about depression. Let me start with the general information that what is depression. Depression is a common and serious medical illness that negatively affects how you feel, the way you think and how you act. Depression is a disease related to a person's emotional and mental health. Depression is a serious illness because not only does it matter with someone's emotions and thoughts. Depression causes feelings of sadness and loss of interest in activities once enjoyed. It can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and at home. Depression make it hard to enjoy family, friends, favorite activities and lifestyle. It can also cause physical pain. So next is what are the causes of depression? Depression is an extremely complex disease. No one knows exactly what causes it, but it can occur for a variety of reasons. Some people experience depression during a serious medical illness, others may have depression with life changing such as a move or death of a loved one. Biological depression is difference in certain chemical in the brain may contribute to symptom of depressions. And genetical depression can run in families. For example, if one identical twin have depression, the other has a 70% chance of having the illness of sometime in life. And the third one is health conditions. Sometimes depression coexists with a major illness or may be triggered by another medical conditions. Fourth one is age. Depression happens especially in teens because they are just finding who they are and they could not get and they could get discouraged easily. And the target of depression is middle ages and teenagers, university going students. And the next one is death or a loss. Sadness or grief from the death or loss of a loved one through natural may increase the risk of depression. Next one is changing changes and stressful events. Major events, even good events such as starting a new job, graduation, or getting married, can lead to depression. So, can moving, losing a job, income, or getting divorced, or retiring. However, the syndrome of clinical depression is never just a normal response to stressful life events. Next one is medication and substance. In substance abuse, nearly 30% of people with substance abuse problem also have major or clinical depression. Even if drugs or alcohol temporarily make you feel better, then ultimately will aggravate depression. So next is what are the symptoms of depression? The main symptom of depression is feeling sad or have a depressing mood, loss of interest in day-to-day activities and weight changes, weight gain or weight loss. Next one is low self-esteem, feeling worthless and emptiness most of the time. Next one is changing in typical behavior, difficulty in thinking, concentrating and making decisions. And the next one is difficulty thinking and concentrating same, and next one is increased pain, and the last one is thoughts of suicide. It is something a way for people to escape pain or suffering. When someone end their own life, we say that they died by suicide. So next is what is suicide? Untreated depression can greatly increase the risk of possible suicide. Some warning signs of suicide with depression are feeling like nothing make you happy anymore and feeling very sad or hopeless for many weeks, feeling like you cannot cope with things that happen in your life, feeling very stressed or scared for many weeks, sleeping less or more than usual, eating less or more than usual, drinking more alcohol, taking a lot of time off work or school, avoiding family and friends, feeling sick most of the time. So next is how can I help someone who is thinking about suicide? Take the other person seriously. They are in pain and they need to help. Show the other person that you are a good person to talk. Do not judge them and or make fun of them. Trust is very important. Do not make promise that you cannot keep. And next one is show that you understand they have a serious problem. Do not give advice like a cheer up or pull yourself together. So next is what are the types of depression? There are two main types of depression. First one is first one is major depressive disorder and second one is persistent depression disorder. So let's talk about major depressive disorder. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest, also called major depressive disorder or clinical depression. Major depressive disorder is the more severe form of depression. It characterized by persistent feeling or sadness, hopeless, and that do not go away on their own. So next is in order to be diagnosed with clinical depression, you must experience 5 or more of the following symptoms over a day to 2 weeks period. First one is feeling depressed most of the day, and the second one is loss of interest in most regular activities, and third one is weight loss or weight gain. Fourth one is sleeping a lot or not being able to sleep. Next is slow thinking or movement. Next one is low energy most days. Next one is feeling of worthlessness or guilt. And the last one is requiring thoughts of death or suicide. Next type is persistent depressive disorder. In this, you may lose interest in normal daily activities, feel hopeless and lack productivity, and have low self estimate. Persistent depressive disorder used to be called dysthymia. Dysthymia is a milder but chronic form of depression. In order to in order for the diagnosis of this symptom must last for at least 2 years. It can affect your life more than major depression because it lasts for a longer period. It's common for people with these symptoms lose interest in normal daily activities and feel hopeless, lack productivity, have low estimate and so next is how to treat depression. First is psychotherapy. Psychotherapy, also called talk therapy or just plain therapy, it is a process whereby psychological problems are treated through communication and relationship factors between an individual and a trained mental health professional. Psychotherapy may help a person manage their symptoms or depression. Depression is treatable and managing symptoms usually involves three components. First component is support. This can be range from discussing practical situations and possible cause to educating family members. And the next one is psychotherapy. Therapists are trained to understand what you say, your words, how you say them, and which ones you do not use. They pay attention to body language and voice tone to fully understand your speech. And psychotherapy, also known as talking therapy, some options include one to one therapy. And the next one is drug treatment. Medication and psychotherapy are effective for most people with depression. Your primary care doctor and psychiatrist can prescribe medication to relieve symptoms. However, many people with depression also benefit from seeing a psychiatrist, psychologist, or other mental health professionals. Drug treatment, a doctor may prescribe antidepressant medications. Many type of antidepressants are available. First one is SSRI. These medications cannot be combined with SSRI. Using MAOI require a strict diet because of dangerous or even deadly interaction with food such as cheese, pickle and wine, and some medication and herbal supplements. Tricyclic antidepressants. These depressants are very dangerous and are very effective but tend to cause more severe side effects than newer antidepressants. So tricyclic generally are not recommended by doctors. And the next are some natural remedies for treating depression. Some people use natural remedies such as herbal medicine to treat mild to moderate depression. First one is ginseng. Ginseng effectively regulates the immune response and the hormonal changes due to stress. Ginseng also prevents stress, anxiety, and depression. And the next one is chamomile. Chamomile reduces anxiety and depression and boosts energy. And the next one is lavender. Lavender in Urdu called huzam. Lavender traditional folk medicine maintain that the smell of some plants can calm the nerve, and new research is suggesting that this plant relieve anxiety and stress. And the next one is eat healthy. There is no magic diet that fixes depression. There is a good idea to watch what you eat. If depression tend to make you overeat, getting in control of your eating will help you feel. Cook said that there is evidence that food with omega-3 fatty acid such as salmon and folic acid, spinach, avocado could help ease depression. For the treatment of depression, fruits, vegetables, fishes, and and olive oil are prescribed by doctors. And next is exercise. Exercise is very important. It may help long-term benefit for people with depression. Regular exercise seems to encourage the brain to rewire itself in positive way. Cook says, how much exercise do you need? You do not need to run marathon to get a benefit. Just walking a few times a week can help. And that brings us to the end. Thank you so much for your interest and attention. And that brings us to the end. Thank you so much for the interest and attention.